Awesome. We'll give folks a few minutes to join, and then we'll go ahead and get things kicked off in a minute or so. Great. So we'll go ahead and kick things off and let folks continue to roll in and join us. But thank you all who have joined for our presentation today. We really appreciate the attendance of both our current care message customers, as well as those of you who are just interested in learning more about how an FQHC in Chicago has navigated the COVID-19 pandemic and communicating around the vaccine updates throughout the distribution phases. And so today I'm excited to hear from Erin Howes, the Director of Quality Improvement at Prime Care in Chicago. My name is Jessica Barna. I'm a part of our growth team here at Care Message. For any of you who are not familiar with Care Message, we're a nonprofit organization that leverages technology to help safety net organizations fulfill the essential needs of underserved populations specifically. And we did this primarily with a text message-based patient engagement platform, and most recently have been partnering with FQHC's free clinics and other safety net organizations to deliver messages related to the COVID-19 vaccine. And so we've seen about 2 million messages and counting, a lot of which have come from Prime Care that we'll hear from Erin about. But a few quick logistics before I pass things off to Erin. Please feel free to ask any questions throughout the course of the presentation. You can click the Q&A button you'll see on Zoom or the chat. We'll do our best to get to all questions, but feel free to ask those throughout the presentation, and we'll get to those at the end. And we'll also be sharing the recording and presentation slides out to everyone after the webinar is completed so that you all can share them either with your colleagues or rewatch any details you may have missed. So with that being said, I will go ahead and hand it over to Erin. Erin, you can go ahead and take it away.
Thanks, Jessica. I appreciate it. Hi, everyone. Thanks for joining today. So as Jessica mentioned, I'm the Director of Quality Improvement at Prime Care Community Health Center. We are an FQHC in Chicago, Illinois. So just a brief background, because I know that's helpful when you're communicating with other organizations. We do have 6 sites that serve the west and northwest neighborhoods of Chicago. Our UDS numbers for 2020s showed about 22,000 unique patients served. 68% identify as Hispanic or Latino, and 36% prefer a language other than English. So that's a good mix for us of Spanish, but also Polish. We serve one of the largest Polish communities in Chicago. So that's another workaround that I can talk about later with other languages in terms of communication. Our EMR is Athena. And, our patients, we offer a full practice. We're a family medicine practice, and we have medical, behavioral health, dental, and substance use disorder MAT services as well. So that's just a little bit about us. So we have this kind of timeline here. I'm sure it will be similar to what, depending on your state, things have looked different, but this is kind of our COVID vaccine journey that we've been on. In the beginning of January, I was a pretty big advocate to our leadership team that we just needed to say something. I was watching my parents who are over 65 just be completely stumped about, like, no one was contacting them. They just had no information. And I kind of use my personal experiences to, honestly, I use that to drive all of my care message journey. So I was like a big advocate that we just need to say something. So we did do outreach to the patients that we had seen in about the past 13 months at that point. And that was about 22,000 patients where we said, listen, we don't know anything, but we know you're there. And it was really well received, lots of like smiley faces and like thumbs up back on the care message. So we felt good about that. We were notified about a week later that we would receive our first doses of the COVID-19 vaccine. So I'm sure, like many of you, we had some late nights and had to create a system and operationalize having a brand new vaccine. So a few days later, once we knew the exact date we were going to get the vaccine, I ran with care message. So I started with patients 65 and over with 2 or more high risk conditions. Again, we had just gotten this vaccine, it was very new, very stressful, and we didn't know what the response rate would look like. And if any of you on the call are frontline or more operations staff, that was a big ask of me, like, don't break these phones, Erin, don't. And so we started with this small group to just test out a message and see how it went. And we vaccinated our first patients within 4 days of being notified that we would have vaccines. And we also implemented a waitlist workflow. So again, a lot of these things are going to be EMR specific. I'm sure people are using Excel, using different things. Athena has a waitlist function, and we have found that very helpful in COVID vaccine planning. So by February 16th, we knew that vaccines could be available to all of our patients 65 and over, following the guidance that we get from the Chicago Department of Public Health. And we started rolling out that outreach. And by February 24th, all of our patients age 65 and over had been given the opportunity to be added to the wait list via a care message text. And I'll break down our messages in the next few slides. And where we are today, we are in a confusing place. I'm sure you guys are from all over the country, but Chicago kind of identifies as its own state in terms of this process. So we have a big mix of what's happening in Illinois versus what's happening in Chicago, and we're kind of waiting. But we did confirm this morning in a COVID meeting that we as an organization will move forward with patients 55 to 64 now. We've touched all the 65 plus, so let's look at that group and focus on conditions. So similar to what we did on that 126 bubble, we'll go back, look at conditions and age. You can go to the next slide, Jessica. And so our approach has been a mix. Of course, we like to use our website. Engage, our manager of marketing, has been extremely helpful. Things like LinkedIn, Facebook, our websites, any type of social media, just to say like where we are and who we're vaccinating, or share messages from the city about our phases, things like that. We of course have phone calls going between our actual call center, but then also engaging other staff like patient navigation and care coordination type staff. Nursing have been very busy helping us. We have contact tracing staff that have been repurposed to help with this. So all hands on deck. And then of course, text messaging with our care message partnership. So this is kind of where we've been in our workflows, and then I'll hop back and forth like what I've learned. Your EMR is extremely helpful. So when you're planning a text message campaign, and the reason I like care message so much is that I can filter all of my data and make it as clean as I want before I upload it into an outreach, right? So using things like age and diagnosis filters have been great. If you are a practice that collects job titles, for example, that could be something you use to vaccinate essential workers. We don't have that, so we've been trying to get creative, but definitely like date of birth and diagnoses have been helpful. You want to make sure you're reaching everybody. A lot of people don't have mobile numbers, or when we send the care message, there is the function to see which messages were undeliverable, polling those and sending that to a different list. So not only relying on the text message, but seeing what bounced back and who wasn't reached by that, and making sure that they get the phone call to let them know that they're eligible for a vaccine. We always have this wait list going back and forth. Providers can add to the wait list, any staff can, plus then with our messages. And we've kind of been playing with different message types. So that's also on like one of my learnings is, vary your message type, try a yes, no campaign. Like, do you want this vaccine? Yes or no, and see what happens. But then we also move to a multiple choice model down the road to solicit more information. So we'll talk about that. And again, I understand the stress of like, Erin, are you about to text 22,000 of our patients? Like, what are you doing? What's going to happen? Are they all going to blow up our phones? Is everyone going to be confused? So just really starting small is totally okay. Like do 100 with a yes, no, and do 100 different patients with multiple choice, see what type of response rate you get. And then that can inform how much you're able to send with your capacity. And then consider literacy levels, especially with language. Like I mentioned, we do some workarounds to be able to send messages in Polish. So you just want to plan all those out, test them with a few staff, read them with each other, and just, I always check literacy levels before sending or creating anything. So I did want to share our message types. I'm sure Jessica can share these slides. You don't like jot all this down, but the first one was what I mentioned when we didn't know anything. But so we were, that's at the bottom there, is just kind of building that vaccine confidence. So a message from Prime Care: we do not have the COVID-19 vaccine, but we recommend it. We'll let you know. And that was like really well received. I'm glad we had sent that out. And then now we have this wait list. So the first one is this like yes or no option, like please reply yes if you want to be on the wait list. That was really great in the beginning, but then what we found is a lot of patients were texting me back free text of like, hey, I already got it. And I was like, oh, okay, lesson learned. So then I moved to this multiple choice model. So same intro, we have a limited supply of the vaccine. You are eligible because, and then enter Y or whatever phase you're in. And then please reply A, B, or C. And what I was nervous about was, would giving more options mean a lower response rate? Would that be confusing to people with lower either reading literacy, but also technology literacy? But I did get the same. We have about a 20% response rate for every message we send out about this. So that made me really happy that it stayed. And then with this gives us great data. I want to be on the wait list. I don't want it at this time, or I already received it, because then we're able to check our state registry and get their vaccine info added to our charts, which has been great. And then we, of course, use it for other vaccination messaging. We just did one this week since kids are going back to school in Chicago, and a lot of them are out of care and out of vaccine compliance. So we want to just do a quick blast and check on our kids too, and not forget about ongoing quality initiatives that don't stop in COVID. So we've had, there's been a lot of challenges, trying to figure out who's eligible in our city. Where do they live? Are they in the right zip code? Are they the right age group? It's always changing, and we don't want to get in trouble and not use our vaccine stock in the right way. So just keeping up to date with eligibility and the rules that are laid out by the departments of health. And, we can't identify essential workers. So that was hard for this most recent phase. I felt bad that we couldn't but it was like, how could we even do that? Even if I asked them to text back their job, or I personally couldn't figure out a way. I'm curious if anyone else has a way to check on your essential workers. We also have staff limitations. We did not hire more people in COVID, right? We are trying to build a whole COVID-19 vaccine program on top of our existing workers. So just making sure that we're rotating and checking in on people. Trying to not have an increased call volume, but of course that happens. And also just trying to figure out how many vaccines are we even going to have. I don't want to send out a text to 1,000 patients. And then we've had a lot of fellow health centers that had their vaccine supply cut. So then you kind of tell people, or schedule them even, and tell them they're coming in, and then you have to cancel it. And that's just been really stressful. Go to the next one. Beautiful. So for the future and things that we're thinking about now, vaccine availability and eligibility are going to keep changing. The Biden administration will release things too. So we just keep our eyes on it, and we'll just keep notifying our patients as we are able. As I mentioned, we're going to move with the chronic conditions of patients 55 to 64. So that'll be my homework this week. And then as the quality director, I'm trying to balance this outreach, of course, but I have other things I need to monitor. We have UDS, HEDIS. So I need to fit in, we want patients to know about this, but I also want to communicate with them about their outstanding care. So how do I balance that? And as I've been talking to the care message staff about, right now we're just trying to notify people and see if they even want it, but we do need to think long-term for summer and fall, when this banging down our door feeling will be gone, and COVID vaccine will be another quality measure, just like all the others. And we'll need to do education and outreach, and it'll be a total switch of trying to get all these people now who have said, no, I don't want it, throughout this time, and start educating. So we've got some marketing materials ready. We've been filming providers. So we're thinking we'll send out links to like our Facebook and YouTube. Like, hey, here's your doctor talking about the vaccine, just kind of fun, trying to plan things like that for what I'm hoping, you guys, is a very boring summer and fall. So those are my hopes. And I think that's my last one, Jessica. Thank you.
Awesome. Thank you so much, Erin, just for sharing your team's approach to patient engagement and some of the workflow updates that you've gone through, and we'll certainly take some questions at the end for many folks who
Sure.
want to ask you anything specifically. But I just want to take some time here quickly before we move into Q&A just to highlight a few examples of how we've seen health centers leverage, as Erin's mentioned, the bidirectional text messaging communication to really, at the end of the day, save time for staff that would otherwise be spent on the phone, that we can repurpose that time. So the example we see here is from a care message customer in New York, actually. And what they're doing here is essentially refining their wait list by removing anyone who responds no and letting patients who do still need a vaccine know that they will be contacted as soon as a dose becomes available. And this type of mass messaging campaign would live in, as you heard Erin reference, kind of our outreach feature. And then you can see kind of a fantastic response rate, over 80%, with 44% indicating that they do still need the vaccine, and then 56% indicating that they do not, and hopefully because they were able to receive it elsewhere. And so for those of us, or for those that obviously tell us that they do still need it, want to follow up and get them an appointment. And then, so rather than, kind of in contrast to the last slide, rather than the use of the outreach campaign style feature, we'll kind of move into an example of messenger, or kind of one-to-one to our one-to-one texting feature. And here we've created a template that references both the patient and staff member's first name to make the message feel more personal. And we are quite simply asking for the patient to let us know when they would be available for their vaccine appointment. And a conversation like this can be facilitated over text to either completely replace those outbound phone calls, or to really help supplement your team's existing efforts to get a hold of patients. And again, with the idea here to really help save staff time spent leaving voicemails and fielding, subsequent inbound phone calls, all that back and forth kind of in one centralized location. And you may notice that the last text here lets the patient know to expect a reminder text the day prior. And if you're already a care message customer, we've created and published a COVID vaccine appointment reminder template into your account. And you can find that in the appointments feature. And then obviously, if care message is integrated with your EHR, just reach out to our team and we'll help you set that up as soon as possible. And then finally, and this is a similar example to what Erin shared in terms of utilizing multiple choice questions and text to really help inform workflows for your staff. And in this example, it's really taking a step to try to address any lack of confidence that a patient may have as it relates to the vaccine. And we've seen a lot of health centers send yes or no questions to patients asking if they're interested in getting the vaccine. And for those that respond yes, the next step is self-explanatory. But for those who respond no, the next step may be a bit unclear of, well, why don't they want to receive the vaccine? And so this multiple choice outreach example could be used once you've gotten a good sense of those patients who have said no, or even expressed a lack of confidence in the vaccine. What we're trying to do here is understand what are the patient's top concerns and how can you as trusted providers address those, and provide them with some additional information or give them a phone number to discuss it further. And this might also be a good place, instead of a phone number, to place, as Erin mentioned, their website, and posting videos to their website might be a good place to place a link to the website. And so utilizing something like this could just equip your team with some more information about your patient population and how to maybe address some of those issues or lack of confidence vaccine. And with all of that being said, we will go ahead and move into Q&A, and I will go ahead and check the chat. see if we have any questions. And Erin, if you see any questions come through, feel free to.
Yeah, just one so far about will they get the copy of the slide deck?
Perfect. Yes, everyone will receive a copy of the slide deck as well as a recording of the presentation early tomorrow. And Erin, I like the question you posed. If anyone wants to chime in the chat on if anyone has figured out different ways to reach out to or filter essential workers or kind of using that group. I know, Erin, you posed that question, so feel free to chime in.
Yeah, I'm curious. I do see a chat from Sophia, so I'll address her question because I realize I did a very big overview and I'm happy to dive in. Like, what is the process of you do a care message and then how do you what do you do with that information, right? So like all of our yes responses of yes, I want to be on the wait list. We divvy that out and we kind of just like pick staff as we go. Like all of you, we're learning to fly the plane while it's going. So that we found, I liked delegating that to like case manager. It could really be anyone. You could have some maybe front desk staff or call center staff, the MAs, kind of picking a staff that I send them then all the yes responses. I'm like, here's all the yeses, add them to the wait list. And I just try to give everyone like 20 or so that no one's too overwhelmed, and then they add them. And then anyone who says I already got it, I have definitely wanted to use clinical staff for that. They check our state registry and they have been manually putting in our vaccines and into our EMR, so which is awesome. But yeah, care message is great because I just love any export button. So I export the data and all the answers and I divvy it out.
That's awesome. Erin, can you talk a little bit about two things? One, as you are kind of, got approval today to start messaging patients 55 to 64, what is kind of the process and workflow that you're going to go through in terms of kind of kicking off that outreach to a new group of eligible patients, both from kind of the list creation side, and then also what type of message, given these patients may not have heard from you as frequently, kind of what message you're thinking about for them.
I know it's been since January. I feel bad. Yeah, at this point, it's been a little while now, so we assume people are getting them. So I'll start with your second question. I'm going to keep the ABC. I've really liked that. My CEO and our other chiefs like that we're getting like a yes or a no, because then, like you said, I'm excited for in a few months to talk to all those no's again. And then also the yes, I already got it somewhere else, because then we can update our charts and just keep cleaning up our list. So I'm going to stick with that. And then honestly, the EMR piece, you guys, is the biggest lift. Like everything in care message is so fast, but I really want to have the cleanest data possible to plug into our care message. So let's say I'm going to run a list of everyone 55 to 64 who's been seen, and I'm going to pull some conditions like diabetes, CKD, COPD, things like that. Once I have that list, like you don't want to make people angry, I get, right? Like if I've already gotten the vaccine and my doctor sends me a text, do you want the vaccine? I'm going to be like, what is the quality of this office? Like, are they not looking at my record at all? And so it depends on your EMR and like the different reports and how they talk to each other. But I do 3 layers of filtering. So first, are these people already on our wait list? So I definitely don't want to double up and confuse them. So I remove anyone who's already on our wait list. Then I run like a vaccine report. Have we already given them one, or did they already tell me they got it somewhere else? And then I remove anyone who's already started the series or finished it. And then the third piece is to remove anyone. I've lost my train of thought. On the wait list, already got it. I'm losing it. But there's my 3 filters. But you know what I mean. To get rid of anything in your workflows that someone might have already been messaged about, or like you just don't want to confuse them. Or if they're, I'm sorry, I remember now. If they have a future appointment scheduled, so you kind of have a mix of like, Are they appointment reports? Are they vaccine reports? And, of course, depending on your EMR, that'll look different, but making your list as clean as possible. That way, when you send it, the phones stay quiet. You will also notice I do not put our phone number in any care message text related to COVID vaccination. The people who want to call know where to find us. But that's very uncharacteristic. I think that was a big workflow shift of like not giving out our phone number. But again, we're trying to keep it calm.
Had you done that initially in earlier messages?
No, my
Okay.
my chiefs were like, I think my original text when I was proposing this in January had the number and everyone was like, nope. So that was never on there. But for other things, we'll put it, of course, like if you have questions about your PAP or something, please call us. But for this, we were like, nah, they know where we are.
Yeah, that totally makes sense, and might end up helping. I know some health centers I spoke with have, send out a message with their phone number, and they had, I think, over 1,000 calls that day or something
Yep.
absurd. So we did get a question in from Heather, and I'll just read it out to you, Erin. But how quickly is a batch of messages able to be sent? We did a trial yesterday to 6 people that seemed to take 80 minutes. They're new to care message, so perhaps a user issue. But how's your experience, Erin, been with, when you're sending messages out to thousands of patients, or what does that kind of send time look like on your end?
Yeah, it's funny, Heather, that you mentioned that, because one of my only potential future things for care message is to have like a staggering, because these all send out on the minute. So when I run the report of like when they all get sent out, it'll send like 1,000 texts in 2 minutes. So that's where I get kind of nervous about breaking the phones, like I laugh about, but it would be really neat if I could stagger it like over 8 hours, like, hey, please send 100 every hour. So maybe, yeah, I would check, because mine go quite fast.
That's a good point. Especially when you're sending out messages to 22,000 patients.
Yes.
Awesome. Any other questions? We'll give folks a few minutes. And I'll ask one question while we wait for folks, because I have one more for you, Erin.
Sure.
But how was it in, as health centers are in different positions in terms of communicating with their patients, meaning some have sent many messages, some have sent none. What was it like in those early days as you were getting your team and your staff to, rally around the concept of sending out or leveraging text messaging as a main communication source? But what was that process like, I guess, in getting over that hump of sending out the first message? And I know you talked about, just saying something to patients, but what would you say to a health center who's in that position who maybe haven't said anything or haven't said anything to patients in a long time? What would be some tips you'd recommend there?
Yeah, I was definitely the squeaky wheel. You kind of have to have someone who like stresses the importance of communicating with our patients. I remember talking to Jessica that, I was having a hard time getting going. People were just very nervous to send a lot of text. And I get it, because this is so new to us. We didn't know how fast our wait list would blow up, we didn't even know at the time how many vaccines we were going to get. And it's still pretty low. We're a huge urban, we have over 22,000 patients, and we get a couple hundred a week. So it takes a long time. So my suggestion to people is kind of what I mentioned earlier, is to start really small. Like maybe our first one was 65 and over with chronic conditions. So that was like a nice 300 person text just to start with, see what the response rate is like. Test out your message, see if it warrants a bunch of like confused faces or like calls, or, and then you can revise it. Yeah, or just if your leadership is hesitant because it's going to be a big lift or something, I would just break it down small like that. If you have many sites, we did that with the first 65 and over. We just started with one site. That way, I just could get all hands on deck from that clinic in case there was any drama or stress related to my message. So those are some suggestions I have.
Absolutely. And thank you for sharing some of those. Awesome. Well, I know we are at 2:30 Eastern, so we can go ahead and let folks drop off. But thank you all so much for joining. Erin, thank you for sharing the incredible work that you and the Prime Care team have done over the last few months and hopefully providing some helpful tips and recommendations to teams that are going through um, similar experiences in different locations across the country. So thank you so much for your time. Thank you everyone who joined, and I'll be sending out the recording via email here early tomorrow morning.
Thank you, everyone. Thanks, Jessica.
Of course. Thanks, guys. Have a great day. Bye-bye.
Bye.